Cystic fibrosis is a disease that causes mucus in the body to become thick, dry, and sticky. This glue-like mucus builds up and causes problems in many of the body's organs. Dr. Arnold Platzker of Children's Hospital Los Angeles discusses these problems.
Cystic fibrosis is a defect in the sweat glands and in fact all of the glands in the body that produce mucus. It has to do with a part of the cell membrane called the chloride channel, which is defective in these patients. Some of the patients aren't diagnosed until quite late in life, whereas others can be diagnosed at birth. The usual presentation is a child who cannot gain weight, has loose, often foul-smelling stools that actually float because there's so much fat in them, and on the other hand may also have trouble with breathing, recurring bronchitis, and this disorder progresses and becomes worse, leading to destruction of the airways and in fact the pancreas as well. The diagnosis is actually something that's been available for 40 to 50 years, and that's a sweat test. Patients with this disorder have a high amount of chloride in the sweat, and so with a fairly simple technique, we're able to obtain sweat, usually from the patient's forearm, and to then do a chloride analysis on that test. Our treatments are fairly uniform. We first of all try to heighten nutrition by replacing the enzymes that the patients do not get into their intestine from the pancreas. These are pancreatic enzymes, and we have very sophisticated enzymes these days that are highly regulated, and several manufacturers produce excellent enzymes, and we're usually able to titrate the number of enzymes that the patient needs to the type of meal that they're going to eat. There are also a host of medications that we can do to improve airway function and clearance of mucus from the lungs. I follow a little boy who, well, he's a big boy now, he's 14, almost 15, and I diagnosed him at birth, within hours after birth, because he had an unusual, it occurs in about 15% of patients. It's called meconium ileus peritonitis syndrome, and it's usually typical of cystic fibrosis. So we made the diagnosis at birth, and he's had a number of major medical problems, but at 15 he plays soccer on a soccer team. He also is a musician and has his own band. So I think his lifestyle is pretty good. He takes his treatments and minimizes the problems.
There's really no limitations. You just gotta make sure your lungs are functioning fine. As long as you can, be active, there's no stopping you.
Each cystic fibrosis center, we have an integral team. We have a large division of 8 physicians, and we are able to supply all of the new therapies as well as lung transplantation for those patients whose lungs are unable to support themselves further.